Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on one of the rare forms of a disease, that is Subacute Sclerosing Panencephalitis or Dowson disease, or it is also known as SSPE. Basically, this is rare and deadly complication of measles. Measles is a viral disease which the people who are not vaccinated will get in their childhood, but there are many complications of measles. One of the complication is SSPE or Subacute Sclerosing Panencephalitis. This is a deadly complication of measles. It is claimed that out of 10,000 people who are suffering from measles, one or two of them will get this SSPE or subacute sclerosing panencephalitis. Out of 100 people who have landed into SSPE, only 5% or 3% of them recover spontaneously. That recovery is not complete. So what happens is, in only very few cases the recovery is complete. In most of the cases it's partial, and the people survive but they don't thrive. Basically, they need lifelong support from their parents or from their siblings because the symptoms are not completely recovered throughout the life. Recovery happens only in 3 to 5% of the people, but majority of the people, 95% of the people, are going to die with this disease. The problem with this disease is, most of the internet or most of the allopathic doctors will say this is deadly disease, 95% is death rate. But in homeopathy this has very good treatment. I have seen some homeopathic doctors claim that there is 70% success rate in SSPE or subacute sclerosing panencephalitis. Such is the importance of homeopathy in case of subacute sclerosing panencephalitis. So do not neglect this video. So homeopathy is the best option you have for SSPE or Dowson disease. This is a late and rare complications of measles. What happens in your brain and nervous system is there will be demyelination. Demyelination means you have nervous system, right? Every nerve cell is surrounded by a myelin sheath. That myelin sheath is going to be destroyed and there will be faulty signals within the brain and nervous system because of this disease. This is an inflammatory condition of brain and nervous system. Coming to the signs and symptoms, it takes almost 7 years on an average to develop symptoms after the exposure to measles virus, and this can range from 1 month to 27 years. There are cases SSPE has developed within 1 month, and there are cases where it can go from 27 years. After 27 years of measles infection, you can have this SSPE, but on an average it takes 7 years for to develop the symptoms. And the thing is, it is not that you have to have measles compulsory in your childhood. There are some cases where they have not suffered with measles, still they have landed into SSPE, but that is very rare. The people who have taken the measles vaccine in their childhood, in some cases they have also developed this SSPE. What it means is, taking measles vaccine is not 100% protection for SSPE. So there are some cases where they have taken measles vaccine but still they have landed into SSPE, but that is a very rare case. You should not ignore vaccination for measles. Measles vaccination is mandatory for everyone. This SSPE is divided into 4 stages based on their symptoms. First 6 months is called stage 1. In this stage there will be personality changes. Personality changes means suddenly the kids become aggressive, or they become dull, or they become suspicious. There are a lot of personality changes. There will be mood changes. Mood changes means they will be sad at one time, they will be happy at one time. Lot of mood fluctuations you can see in the earlier stage. And also depression. I have seen kids with lot of depression in this disease. They can be fever, they can be headache, severe headache, they can be loss of memory, and this stage can last up to 6 months. And coming to the second stage, there will be jerking movements of the muscles, hands or legs or any part of the body. There will be sudden jerkings, there will be muscle spasms, there will be severe contraction of one or two muscles in the body at a given time. There will be seizures. Seizures means epilepsy, loss of consciousness and involuntary movements of some parts of the body. Loss of vision, they can be partial loss of vision or complete loss of vision, or they can be dimness of vision as well. This occurs in stage 2. Coming to the third stage, there will be twisting movement. There will be sudden twistings of hands and legs or complete body, or there will be complete loss of vision, and at times the death can happen in third stage itself. And coming to the final stage or fourth stage, there will be loss of consciousness. People become completely unconscious. There will be vegetative stage. Vegetative state means only your vital organs will be working, or autonomic organs will be working. Rest of the things you will not have any pain or nothing. You will be just like a tree or plant in the wild. There can be problems with breathing and also heart rate. There can be arrhythmias where the heart beats fast or slow, breathing can become fast or slow, and there can be changes in the blood pressure as well. Death usually occurs because of fever and infection at the final stage. And finally, people die of heart failure because the autonomic ability of the brain is lost. The brain will not have any control over the autonomic nervous system or autonomic functions of the body, such as defecation or breathing, respiration. Finally, the patient die of heart failure. And coming to the investigations, first one is EEG, electroencephalogram. There will be characteristic changes in the EEG, the brain wave function. So with that, we can identify this is as SSPE. And coming to MRI and CT of brain, where you can visualize the inside of the brain. What happens here is there will be a lot of atrophy. Atrophy means shrinkage of brain. Normally, shrinkage of brain should happen when you are old, but as a child, you will have shrinkage of brain, and because of this there will be lot of symptoms. And CSF examination means cerebrospinal fluid, we take it out, or blood we take it out and check for the antibodies. Lot of antibodies for measles virus is present in both CSF and blood. This is confirmation for SSP. And brain biopsy, previously a gold standard for diagnosing the disease is brain biopsy, where they take the small part of your brain and observe in the microscope, where they can find measles virus. But this is not gold standard, this is not done as of now, but the diagnosis is straightforward and very easy to diagnose SSPE along with the symptoms of SSPE. And coming to the causes, what are the causes for this disease? One is childhood infection with measles virus. Some people, even though they have not exposed to measles virus, they can develop in the adult age. Important thing here to remember is there are some wild strains of measles virus or some mutated strains of virus. This can cause SSPE, not the common virus always. So you have to be very careful when the mutations or when the wild strains of measles virus enters into your body. Coming to the pathology or the changes that occur in a person who is suffering with SSPE, first one is these measles virus are going to infect nerve cells and glial cells. Glial cells are the supportive cells of the nervous system. Both the cells, they will enter and they will multiply there. Basically, virus is a capsid. Capsid means viral RNA is present inside the proteinaceous coat, that is capsid. There will be lot of capsids that is developing in the neuron and also glial cells. The important thing you have to observe here is, see, normally this is an envelope virus. Envelope virus means there will be a phospholipid surrounding the virus. What happens when the virus has phospholipid means there will not be any proteins, or there will be very minimum of proteins on the surface. So when there are very minimum of the proteins, it will not evoke the immune response. Immune response is evoked only when you have sufficient amount of proteins on the surface of the virus. As there are no sufficient amount of protein, or M protein we call, on the viral envelope, so this is not detected by our immune system, so that the immune system can kill it. So it escapes the immune system and develops and finally destroys the nerve cells as well. Basically, it demyelinates the neuron. Demyelination means every neuron or the parts of the neuron is covered with an envelope that we call as myelin sheath. This myelin sheath is removed because of the infection, and there will be wrong conductivity of signals within the brain and nerves. That is the main pathology we see in SSPE. Coming to the conventional treatment. Conventional treatment is a treatment which is known as allopathic treatment or English medicine or Western medicine, or the treatment you take from a neurologist or a corporate hospital or a doctor who is near your home. So all these come under conventional treatment. Conventional treatment is very limited. They claim that out of 100% who are suffering with SSPE, only 5 will survive. There is no treatment for this disease from their perspective. There is some treatment, but only in initial stage, mostly antivirals they will give, but it is not useful. But most of the cases are going to die. And coming to homeopathic treatment, there are very good scope in homeopathic treatment. I have seen some homeopathic doctors claiming 70% success rate in SSPE. What it means is, out of 100 people who are suffering from SSPE and taken the treatment from homeopathic doctor, 70% of them survived. How homeopathy can help in this regard? Irrespective of the stage 1, stage 2, stage 3 or stage 4, it is very effective. It will do two things. One is it will improve the quality of the life, it will improve the duration of the life. Sometimes it may completely cure the disease as well. Even I have seen lot of cases where they have completely recovered from SSPE. As it improves the quality of the life, what it actually does is it will reduce the intensity of the symptoms, it will reduce the frequency of the symptoms, and also it will reduce the duration of the symptoms so that the quality of the life will be increased in any regard, and also quantity of the life will be increased. The lifespan of the patient can be improved as well. But in some cases I have seen complete recovery as they become completely normal as well. It is very important to remember that for any patient, homeopathy is very important. It can definitely help him to improve the quality of the life, to improve the quantity of the life or duration of the life, and also sometimes it will completely cure the disease. All are possible in homeopathy. And coming to the precautions, there are no specific precautions to be taken for the disease, but as a general rule, you should be on good diet, you should be exercising regularly, you should be on stress-free life, and also you should be away from habits, whatever you have, and you should exercise regularly. If you take homeopathic medicines along with the lifestyle modification, whichever are possible, so high chance that you will recover from SSPE. And coming to the prognosis, on an average, without homeopathic treatment, the life expectancy is only 1 year to 3 years. There is one more variety within SSPE, that is fulminant SSPE. This is very deadly disease. The patients are going to die within 3 months to 6 months of the onset of the symptoms, but this is very rare. No need to worry about this as well. Finally, without homeopathic treatment, there is only 5% survival rate. But with homeopathic treatment, I have seen the homeopathic doctors who have claimed that their success rate with SSPE is more than 70%. Such is the importance of homeopathy in treating SSPE. Not only the survival rate, the quality of life can be increased by decreasing the intensity of the symptoms, duration of the symptoms, and frequency of the symptoms, and also the quality of the life also can be improved by improving the lifespan of the patient. Sometimes cure is also possible with homeopathic treatment. Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor Fidicus Homeopathy. Fidicus Homeopathy is chain of homeopathic clinics where we treat rare diseases here. We have two kinds of services. One is online treatment and in-person treatment. With online treatment, wherever you are in this world, you can contact us and have a call based on your preference, video call or audio call. Normally for SSPE, we take video call and look into all your reports. If any reports are needed, we ask you to get it done locally at your place, and after the case is completely understood, we ship the medicines to your doorsteps wherever you are in the world. We are treating the patients from US, UK, France, even Pakistan. We are treating entire world. We are treating with online treatment, and we have multiple locations. Inquire for the nearest location. You can come to the nearest location and take the treatment physically as well. At Fidicus Homeopathy, you have highest success rate for any disease. For any given disease, we have the highest success rate compared to any other homeopathic clinic or any other homeopathic doctor in the world. Thank you.
Fidicus Homeopathy.